Good Wednesday evening. I'm Andrew Luria. We begin tonight with coronavirus hospitalizations on the rise across San Diego. Tonight, more than 700 people are in the hospital because of the virus. That includes more than 200 who are in the ICU. Our Misha DeBono starts us off with the new warning tonight.
We're seeing a big upswing in those kinds of admissions, and the trends are that we're going to see that upswing continue over the weeks ahead.
San Diego County hospitals are reporting a rapidly rising upward trend in COVID-19 patient admissions, and it's being echoed across the state. Dr. Jess Mandel is Chief of Pulmonary and Critical Care Medicine at UCSD Health.
When we speak with our epidemiologists and review the modeling, that trend is expected to continue at least into January. It's going to put a very big strain on the hospitals and the people who work in them.
On average, 12% of those who test positive will be admitted to the hospital. Across California, admissions to the ICU are up 67%. And now health officials are looking to ICU bed capacity as a trigger to implement another full shutdown.
Yeah, ICUs are our last layer of defense when people become the sickest and really need those levels of support to keep them alive. It's very labor intensive. It's very intensive of equipment. We look at those numbers very closely.
And that's the other issue. If capacity is overwhelmed, quality of care can suffer as staff and equipment and space is stretched too thin.
It's a big challenge to deliver care anything in any manner differently than we do it every day.
If the upward trend continues, experts estimate we could see a tripling of hospitalizations by Christmas. At last count, roughly 800 COVID patients were admitted to San Diego hospitals. In 3 weeks, ICUs could be at 112%. But it's not just capacity that's taking a toll.
This is very stressful on many levels. There's the physical stress of all the extra days, nights, and weekends that we're doing. There's the emotional stress of dealing with so many sick people and in a manner because of isolation where their families are not around them all the time as well.
And again, these next 3 weeks will be critical as they look at these ICU beds and other measures to see exactly where we are in terms of the surge. They say, you know, the optimism is there with the vaccine, but that is months away, and they do recognize that these next few months will be very tough and a lot of hard work for our healthcare workers. So everybody needs to stay the course, continue to wear the masks and social distance. From North County, Misha DeBono, Fox 5 News.
Misha, thank you. Today's county coronavirus briefing started with the recognition of the more than 1,000 San Diegans who have now died from coronavirus. County supervisors also had a warning that cases are likely to be on the rise because of Thanksgiving gatherings, and they urged everyone to hold off on having holiday celebrations indoors.
There's a lot of debate and discussion with individuals who say, well, I want to spend the holidays indoor with my families because that's what we historically and traditionally do. And I think it's important that we remind ourselves that there are more than 1,000 San Diego families who will not be spending the holidays with their family members, not because they're making the decision to be responsible and be safe, but they're not doing it because their family members are dead. And we're not asking San Diegans to give up every holiday forever. We're asking San Diegans for this holiday season to please join us out of a commitment to preserve life, out of a commitment to protect our region.
The county officials also announced more than 1,200 new cases today with a positive rate of 6%. 16 more deaths also announced, as well as 18 new outbreaks, including 6 of them at faith-based agencies.